can you discuss what and how you see digital equity and inclusion? These are new phrases, new terms.
Well, you know, and I don't want to repeat myself too much, but that urban-rural divide to where you are going to see, you know, access to current information, access to, you know, we talked about education, telehealth, things like that. But I think, you know, we've done as a legislature, especially this last round. I think we really put an emphasis on making sure it gets to the areas of the highest need. And again, it's nothing against your more urban areas, but I definitely think there's no doubt when you look at the numbers, the speeds, and the people who have access that our area is absolutely struggling in Western North Carolina, and you've got a whole set of advocates in Eastern North Carolina who are saying the same things down there. And you know, I think it could be divided into, you know, there's certain corridors that in between those you're going to get better access, and you're going to get higher access to information. Out here, I would definitely say that I think the partnerships we've developed, the public-private partnerships, have really helped in our areas closer, you know, closer to our towns and cities. But that getting out and doing that, what we call the extra mile, is really where we see it's going to be very expensive. The company's margins are not going to be as good, and we have to do all we can to say, you know, we want you to succeed as a provider, but also we don't. You know, we don't believe in one provider having, you know, boxing others out just for the sake of doing it. You know, we want to open it up and be fair and give everyone a chance to provide and succeed as a business. But, you know, if somebody's not going to provide, we need to bring in people who will. So that's probably a conversation for another question. But you know, just wanted to touch on with that urban-rural divide. It does become harder on these companies to make the money they would in other areas. But we have to have the systems in place to make sure they still are making efforts to provide here.